Welcome to TOPS, the treatment option program for people with chronic kidney disease. Hi, I'm Shad Ireland. I'll be your host as we discuss chronic kidney disease and the variety of treatment options that are available. I'm not a nephrologist or a nurse, but I have been a dialysis patient for nearly 30 years. I was diagnosed with kidney failure at age 10, and as a boy and young man, I struggled with anger, sadness, and despair. Eventually, I realized that the only way to get back my life was to take control of the things that were important to me. I'll introduce you to a diverse group of dialysis patients, each of whom has chosen a different approach to renal replacement therapy. They'll explain how that choice has enabled them to live the life they want. Perhaps you'll recognize yourself in one of these scenes, and we can help you to choose the treatment option that's best for you. The treatment options for kidney failure fall into three general categories: hemodialysis, peritoneal dialysis, and kidney transplant. Let's begin by looking at the form of treatment that people commonly think of when they hear the word dialysis. Hemodialysis filters the toxins and excess fluid in your body directly out of your blood. The blood is removed in small amounts from an access site, typically in your arm, called a fistula. Blood flows through a disposable filter called a dialyzer, where the impurities are removed. The dialysis machine itself is primarily a pump that maintains a constant flow of blood through the filter. It also monitors a number of vital functions in order to ensure the patient's safety.
I really chose it more for personal reasons. I think I prefer the clinic over home dialysis because, like I said, I have problems with my left hand, and it's hard for me to do things with just one hand sometimes.
Now, for those who want more free time during the day, they can choose to be dialyzed at a clinic overnight. The nocturnal hemodialysis program is a great option.
When you get off the machine, at that time in the morning, you feel as if there wasn't any major effect on the body there. You can still walk with a lot of stability. The nocturnal program is a vast difference. It's like night and day.
As soon as we start here doing dialysis, he changed. There was like a miracle because his face changed. He started feeling better, more stronger, more happy. He's another man. He's another man because we can do everything together. So we can plan to do this day dialysis, the other day off, we can enjoy, go out.
Peritoneal dialysis uses the membrane which surrounds the abdominal organs to filter waste products and excess fluid from the body. A permanent catheter is placed inside the abdominal cavity where dialysis solution is introduced. Waste products from the body are diffused into the solution, which is eventually drained and discarded.
With the solution, it's like you don't really think of nothing of it. You know, you do it, goes in, removes all the toxins, fluids, and everything that you needed to remove, and it's just like sometimes I don't even feel like I'm doing this treatment.
It's natural.
It's natural, exactly.
I think the PD done wonders for me because it just, something about it just makes me feel better. I can get up and I'm ready for my day just like anybody else, ready for their day. And take my granddaughter to school and things like that, so it's ideal for me, really.
Finally, the third category of treatment options, considered by many people as the gold standard, is a kidney transplant. A transplant means that a kidney from either a living or deceased donor is removed and implanted into the patient. This new kidney then takes over the job of the patient's failed kidneys.
The doctor said you're going to get a kidney, you're going to get a new lease on life. There are going to be some changes. It is not a cure, but he said it is an extension and it's a gift, and with all the medical advancements, you're going to have your life back.
That should work.
I hope that our stories will help you find what inspires you to live your life to the fullest. Thank you. And remember, an individual inspired can accomplish anything.
If you or someone you know has chronic kidney disease, call 877-TOPS-LIFE for a free treatment options program near you, or visit us online.